Hello, everybody, and welcome to our presentation today, Unraveling the Mystery of Medicare. My name is Yvette Spillman, and I am the owner and CEO of Wealth Protection Partners. And for about 22 years now, I handle all things retirement planning, including Medicare. So I welcome you. I know if you're approaching Medicare age, your mailbox has probably been chock full of materials, marketing materials from every insurance company in the area, hoping to win your Medicare business. And it can get quite complicated. So I want to just let you know this webinar will really make Medicare understandable and clear for you. And then subsequently, I am available, my team is available to meet with you individually and go over all this information with you one-on-one and help you make a selection of plan that will fit your needs and your budget the best. So again, welcome to the webinar. Let's dive right in. Okay, I have a little catchphrase here that we like to put in with our logo, and we like to say, retire with confidence. And we're not going to do the housekeeping, but we're going to talk about what retire with confidence means. Normally, we would silence our cell phones and do a couple of other things, but we're not meeting in person. We're here on the digital, so we won't worry about those things, even though I did silence my cell phone. First of all, let's go over the agenda and then talk about, again, what that secure retirement means to us. We're going to discuss our retirement action plan that includes Medicare and the transition to Medicare. We're going to go over Medicare A, B, C, and D. So the alphabet soup here will be unveiled. We'll be understanding the two different roads of Medicare and special programs for veterans. And then, of course, the 2020 plans, benefits, and costs are something that we would discuss one-on-one with you based on your individual needs. Lastly, we'll cover just a point on the things that Medicare does not cover, does not include. Now, again, in our individual appointment, we would discuss enrollment, obviously further questions, and have the opportunity to talk to you one-on-one. So let's go back there to our catchphrase. What does it mean to retire with confidence? Well, remember I said for about 22 years now, I've been handling all things retirement, which means Medicare, Social Security, how to maximize that, reducing taxation in retirement, sometimes even eliminating it. And of course, handling the transition of money when you're leaving your job, maybe rolling your 401k to your IRA and securing funds for you that will last you a lifetime. Now, Medicare is a big part of that. We definitely can reduce our expenses in retirement by switching over to a Medicare plan. But the number one fear of baby boomers is actually outliving your money. I'm sure a lot of you are nodding your heads right now saying, yes, that's certainly not something that I could stomach. And then number two, we think about how long retirement can be, how long we can live nowadays, and could we have a care need that we can't afford down the road? Certainly two things to think about, and we won't get into these topics. We're here to discuss Medicare, but we will touch on them briefly just to give you some direction on that. So when we cover our health properly and we establish a strong Medicare plan, that should be one of our points of action, one of the things on our retirement checklist right there at the top. Guaranteeing an income stream rather than just living on Social Security. I often call this personal pension creation. How can we do that? Perhaps something to discuss in our one-on-one appointment. Obviously, reducing market risk. We've seen what COVID-19 and some other things have done to the market to make us look like we're back in 2008. But discussing and controlling market risk, that's also important. Reducing fees, and then long-term care. That's a very important one. Making sure that we have something provided for that. And then tax reduction. How much of your retirement income would you like to give to Uncle Sam? Well, not that much, if any, right? So certainly things that here at Wealth Protection Partners we can discuss with you one-on-one. So let's dive right into Medicare. Medicare can seem like an alphabet soup, can't it? A, B, C, D, F, and G, M, and L, and K. What is all this about? Well, let's start at the beginning. Medicare A is actually the benefit that you've paid into your entire working life. So when you actually go to retire at age 65 or older, you do not have to pay for Medicare A any longer. So what I like to call it is the two H's. Medicare A covers quite a few things, but the two primary things it covers are hospitalization and hospice, or end-of-life care. Now, a deductible does apply to Medicare A, and let's look at it for here in 2020. The deductible is $1,408, and that covers you for a span of 60 days. So if you're in the hospital, say in January, there would be a deductible, and then if you go back in October, there would be another deductible. So that's not annual, it's more of a bit quarterly. And what's nice there, though, is most always you don't have to pay that deductible out of your pocket. Whatever health plan you select will take care of that deductible for you. Now, Medicare B, on the other hand, is a different creature. Medicare B, you do have to sign up for, and there is a cost. It's a small one, but still a cost. Now, Medicare B actually covers what Medicare A does not. So we said Medicare A mostly covered hospitalization and hospice, where Medicare B covers then everything outside of the hospital, doctor visits, testing, therapy, etc. Now, Medicare B has a monthly cost attached to it, which is deducted from your Social Security check. And if you're not collecting Social Security at the time that you go on Medicare, that's okay. They will set up a direct debit from a bank account. Now, as of today, 2020, there is also an annual deductible for Medicare B, and that's $198, and that is paid by most plans, but not all, and we'll explain that later. Medicare B covers 80% of doctor expenses, and those expenses outside of the hospital. However, the 20% that's left over uncapped would normally be left for you to pay. That's the biggest and most important reason that you want to select a qualified Medicare plan to go along with your basic Medicare A and B. These plans would cover the deductibles and the 20% that you're left to be exposed. Now, looking at this chart, if you notice at the top, Medicare B does bear a monthly cost, as we said. That would come out of your Social Security check or your bank account each month. Now, the cost for this year, if we look over to the right, is $144.60 a month. But notice, unfortunately, this cost is tied to your income. So this chart, you can request a copy of it from us if need be. Social Security can also share these dollar amounts with you. But the cost each month for Medicare B does increase as you are a higher income earner. But the baseline, the monthly expense that you can probably expect, is $144.60. Now, we're jumping over to Medicare D. We said Medicare A and B covers both in and out of the hospital, medical expenses, testing, etc. But Medicare D is the prescription drug benefit of Medicare. Now, mind you, some health plans will build this in and others will not. Others require you to purchase a separate standalone Medicare D plan. Now, we'll go over this again in person because there are some important elements here. But Medicare D is not something that you get a card for from the government like you do Medicare A and B. You'll call the Social Security Administration and request your Medicare A and B card. However, Medicare D is only sold through individual insurance companies. The key there, though, is that it's required. You must purchase it or be penalized. Yet the government does not sell it to you. They just require it. A little kooky, I know. But don't get bogged down in the misunderstanding here or any confusion. Like I said, we're delighted to review this with you in person. But just some highlights of Medicare D are as follows. There is, in some plans, a $435 annual deductible. In other plans, there is no deductible. And all you would pay is the plan's copay. So for example, you purchased a drug and you might have a $5 copay, a $15 copay, etc. Now, once you and your drug company together pay $4,020, that's where you fall into that illustrious donut hole, they call it, or the coverage gap. So in that coverage gap, or after $4,020 of benefit has been used up, then you do have to pay out of pocket until you reach $6,350, which is called the true out-of-pocket maximum, or they abbreviate it there, the TROOP. Now, while you're in that donut hole or coverage gap, having to pay for these drugs on your own, something good does happen. They do offer you discounts. I don't want to get bogged down in that, but discounts range between 75% off the cost of a drug down to 70% off the cost of a drug. And if you have so many medications in a year that you've reached the $6,350 limit, then catastrophic coverage begins. And for the rest of the calendar year, all your prescriptions would drop down to either $3.60 or as high as $8.95. So again, nothing to get bogged down in. The key point in this slide is just to understand that you do have to have Medicare D, and it does not come built in with your government card, which is your Medicare A and B. So some plans build Medicare D in, others do not, and we certainly will assist you with that. Now, some people have said, well, I don't take any drugs, so I don't really need this. Well, I would advise in that case to get a very inexpensive plan and have it anyway for such time that you do start taking medication. The reason for that is that there is a monthly penalty that starts accruing when you don't have your Part D at the proper time, which is usually age 65, or when you're exiting your group employer's plan. So a penalty is not just temporary. A penalty is for a lifetime. So better to avoid the penalty, even if you don't take prescription drugs, and sign up for a very low-cost plan. So that's just a brief overview of understanding the three main components of Medicare. But Medicare C is also out there. What is that? Well, Medicare C is actually just a term coined to describe Advantage plans, and we're going to talk about those. There's also a different kind of plan you can enroll in, and it's called a supplement. So Advantage plans versus supplements, you'll have a choice, and we'll examine these. But remember, we put these plans on top of our basic Medicare A and B to shield us from expensive exposure, namely deductibles, and most importantly, the 20% of expenses at doctors and at testing and therapy, laboratories, etc., that Medicare does not pay and does not cap. So selecting one of these types of plans to go along with your basic Medicare is very important. So let's look first at the Advantage plans. What are these? Advantage plans come in different flavors, if you will. And unfortunately, in the realm of Medicare, one of the things that makes it confusing is that there's a lot of jargon, a lot of industry-related terms, and Advantage Plan is one of them, and that's abbreviated MAPD, which stands for Medicare Advantage Plan with prescription drugs built in. So a lot of times it's most advantageous if you're interested in these kinds of plans to go with an MAPD that again has that Part D drug benefit built in free of charge. MAs are just plain Advantage plans without the prescription drugs, and these may be appropriate for some people. So Advantage plans offer different styles of coverage. Some are HMOs. Most of them are HMOs. PPOs can be found. They're a little expensive, and to be honest, I do not recommend them. There is a better option. Private fee-for-service plans, not so popular. We don't see too many of those anymore. And then special needs plans, which I will explain. And again, I just want to state these are plans provided by independent insurance companies and are not provided by the government. These plans pay bills for you from Medicare, if that makes sense. So the plan is in the middle. You have a bill, the plan takes care of it. That bill never actually gets all the way to Medicare. The plan acts as your payor and your gatekeeper, if you will, keeping you safe and providing you coverage. Now, here's some of the requirements of HMOs. Again, these are the most common Medicare Advantage plans. So HMOs require you to have a primary physician who manages your care. And when you have something beyond their scope of expertise, they will refer you out to a specialist, and they will also refer you out for testing. One of the drawbacks to an HMO might be that you do need to stay within the plan's network. Now, most networks are very rich. They have doctors of all kinds of specialties, all kinds of testing equipment. Rare is it in California, especially, that you would have to go out of your own network for care. Now, if you are traveling perhaps or out of your network that you have in your home area, emergencies would be the only things that could be covered under an HMO. So say, for example, you're in New York City, but you live in California. Maybe you've slipped off the curb and broken your ankle, and they take you to a local hospital. That would be considered an emergency. So your care and treatment there would be covered as though you were in your home network. So emergencies covered around the world. Now, most plans have no monthly cost, which is great. You can enroll in one of these Medicare Advantage HMOs free of charge. And they are also very direct in their booklets. They will tell you exactly what copays you will pay for each needed medical treatment. So for example, if you go in for a lab test, they will clearly state in their company brochure how much that lab test will cost you. It's usually $0 to $5, depending on the test. Now, for visiting your primary care physicians, for your specialty physicians, for advanced testing, all those copays will also clearly be stated. And these plans don't allow you to keep paying copays forever. They establish what's called a maximum out-of-pocket exposure, which is nice. It gives you a ceiling. There's no way that you can spend beyond a certain dollar amount. So they do limit your costs in several ways. And for that reason, they're very popular. We won't discuss the PPOs too much because they are not popular, but they do have all the same advantages of the HMOs, except they do let you see doctors outside of your network for a higher cost. Vision and dental benefits can be built into both styles of plans. So if we think of Medicare Advantage plans, we want to think HMOs with a network. But remember that little cartoon character standing at the fork in the road? One way was the Medicare Advantage plan, and he could select that route. Well, this is the other route. These are called Medicare supplements or Medigap. Now, supplemental plans, if you can kind of picture a little sandwich, there's the bread, and then the slice of meat, maybe a slice of lettuce, and then another slice of bread. So if we picture that first slice of bread as being our original Medicare A and B, the supplement is going to be the meat, the next slice that stacks itself on top of basic Medicare. Supplements are called Medigaps because they fill the gaps that Medicare leaves behind. I also like to coin the phrase here, freedom plans. Medicare supplements allow you to be completely free, quite the opposite of HMOs, meaning there is no network and you do not need a primary care physician. So you can go to any physician in any state all across the country and receive care. Again, there's no network and there are no referrals necessary to go to a specialist. The other neat part about Medigap plans is that there are no copays in most of them. So whenever you do go to a physician, you pay $0. Surgery, $0. Testing, $0. However, there is a monthly premium cost for these. They would have a dollar amount that you pay each month to be part of the supplement. They're modest costs, certainly a lot less than medical group plans, major medical, usually somewhere in the area of starting at $150 a month. Now, if you notice the bottom of our slide, these are the plans that cannot have Medicare D built in. So you do have to here purchase an additional Medicare drug plan. They do start at very reasonable rates, some of them even as low as $17 a month. But again, we cannot, unfortunately, due to government ruling, we cannot build them in as part of the plan like we did with the MAPD or the Medicare HMO with prescription drugs built in. Now, if you are a veteran, here's some interesting points. A lot of veterans say, you know what, I just have Medicare A. I can go to the VA and I don't need to sign up for Medicare B. But what we noticed happening at the VA is an unfortunate thing. There's very long wait times, sometimes even days. There's copays to be paid that can be quite large depending on your level of service. There's limited treatment for catastrophic conditions like different forms of cancer. And there are limited locations. So why then would we get the Medicare B if we're a veteran? Well, the answer is to avoid these things. By expanding our availability outside of the VA, we can then avoid the long wait times and these things that we just discussed. We can have full coverage in addition to our VA coverage. Flexibility of choice, you won't be stuck with the rotating VA doctor. And access, of course, to specialized care. Here in California, we're lucky to have some of the best medical groups in the country, UCSD, Scripps, Cedars-Sinai, different ones around the state that are just wonderful networks. And you would have access to some of those, again, outside of the VA. So when you look back and we think about which road we'd like to choose, we have our two choices, which would be, again, staying within a network, perhaps getting a plan that is no cost each month and it's an HMO, or having the freedom to go wherever we want, whenever we want, with no gatekeepers, but for a monthly cost. So that again is Advantage Plan versus Supplement. So what we would do to select in either one, of course, in our independent meeting, in our independent consultations, we would go down the road that you feel comfortable with. First of all, we would select a plan, fill in the appropriate application, and then a couple of enrollment snags apply, if you will. So here they are. First of all, we want to make sure that you have Medicare A and B. That is a must. You cannot sign up for any plan unless your Medicare A and B is activated. And again, you would do that by calling the Social Security Administration and requesting that. On the left, if we are selecting an Advantage plan, you may want to think about a doctor or hospital network that you happen to like or that you've used or are using. We could build a plan or select a plan based on whether or not that doctor or hospital is in the plan's network. We would then complete the application and send that in for you. Now, if it's close to your birthday and you're turning 65 for the first time, the application would be effective, the coverage would be effective on the first day of your birth month. So if your birthday is June the 20th, your coverage would actually be effective June the 1st. However, if it's open enrollment, the annual open enrollment period, and you're just selecting a different plan, that plan would be effective January the 1st of the coming year. So some different caveats that we certainly would go over again in person, depending on your individual situation. However, we have to mention number 3 here on our list on the left. If you do have end-stage renal failure, we cannot apply you for any Medicare plan. You would be picked up by Medicare A, which includes hospice. But again, end-stage renal failure only. That is the only health exclusion that would bar you from enrolling in a plan. You also have to live in the service area that that plan provides. And coverage, again, would be effective the first day of your birth month. Now, if we look on the right, supplement application is a little bit different. We would work together to select a plan for you that fits into your budget. We'd fill in the application, and then we'd have to also select a drug plan to go with it. So just a little bit different application for each one. Now, let's look at the enrollment events. When can you enroll? You can start enrollment 3 months ahead of your 65th birthday. Or if you're leaving a group employer and a group employer health plan, you can then apply for your Medicare B as you depart the group and enroll in a plan at that time. You have 60 days from your date of departure from your job to apply for the group plan and for Medicare B, and for your new Medicare plan. So 60 days from your date of departure from work. Now, you can also apply during the Medicare enrollment period annually, which is called the AEP, and that happens October 15th through December 7th. Now, if we look down just a little bit here to the bottom of our slide, we see you can always call 1-800-Medicare. They are open 24 hours a day, and here's a little trick. If you press 0 3 times, you'll get a live person. You can bypass the phone tree, okay? But I stress to you folks, you cannot enroll for Medicare A and B by calling Medicare. I know that doesn't even make sense, typical government stuff, but you have to wait it out and call Social Security if you're enrolling in Medicare A and B for the first time. Now, they are not open 24 hours a day. They're East Coast hours. They close at 5 o'clock. I believe they also offer extended hours to 7 p.m. And you can also go online to www.ssa.gov. Now, let's say you enrolled in a plan and you're not so sure that you like it. Maybe you picked an Advantage plan and you thought, no, I don't like this referral business. I think I'd like to switch to a supplement. Can you? Yes, you can. Open enrollment period has now returned, and that is January 1st through March the 31st. So from January through March, you can change your mind one time. You can disenroll from your plan and either go back to original Medicare, or you can change your plan again, one time only, to another company. After March the 31st, though, your plan selection is locked in. There are no more changes, unless, there's always an exception, right? Unless you are also on Medi-Cal or Medicaid, and then there are special rules that apply to you. So let's talk about some things that Medicare does not cover. Medicare does not cover random tests that are not ordered by a doctor. So let's say you think something's wrong and you walk in off the street to the hospital and say, you know, I think I need an MRI. Well, that's not covered. But if a doctor orders it for you, it is. Plastic surgery that's voluntary is not covered. But just as an example, perhaps if your face was cut in a car accident and you needed a plastic surgeon, of course that would be covered. Unfortunately, natural therapies, including vitamins and alternative care, is not covered. And folks, here's a very important point. Medicare does not cover any type of long-term care. So if you need care after being in a hospital or after a medical event like a stroke has occurred, that is your own expense. Medicare, again, does not cover anything to do with a short or a long-term care need. Now, skilled nursing is available, of course, under Medicare A, but that's not the same thing. Long-term care can affect 1 in 2 people in our country now. Sadly, in California, it is quite expensive. I can tell you personally from having had care needs for my dad, $96,000 a year is the average cost to be at a middle-of-the-road care facility in California. Even more expensive, $120,000 is the average cost if you'd like to have someone help you out at home. So definitely something that we want to talk to you about in our one-on-one consultation and provide you with a few different ideas of ways to cover long-term care expenses. So again, this is a cute cartoon, but in our individual discussion, we'll take a look at some of the plan choices in our area. There are some great plans tied to great networks like Scripps, UCSD, Miraloma, and others that allow for you to have full coverage with 0 monthly expense for the plan. Again, others say go where you want to go in exchange for a monthly cost. So we'll figure that out for you together. So congratulations, we've covered the basics of Medicare. I know you may have some additional questions. We mentioned at the outset that there were also special needs plans, and we can discuss those again one-on-one. Those are plans that are available. They're usually HMOs. They're available for special conditions like cardiac needs, people who may be diabetic, and they provide for a few extra items. So if you do have a health condition as such, please make mention of that, and we can also discuss special needs plans. But overall, take the opportunity after the webinar to book a free consultation with us, and we can do that over Zoom meeting or hopefully soon again in person, and discuss anything that's going to be appropriate for you. Questions we'll go over together, and I want to thank you so much for your attention and for attending today. Um, Again, we'll assist you with enrollment. This would be something that would be individualized, so we'll hope to see you in person. And here at Wealth Protection Partners, we hope you can retire with confidence, and we hope in this difficult time of pandemic with COVID-19 that you and your families are safe and well. We thank you for being with us today. See you soon.